Good morning to those joining us. Good afternoon, good evening, wherever you're joining us from around the world. First of all, my apologies that we have delayed much longer than I had intended. It's Sunday, and Sunday is always tricky with churches, getting kids ready for church, and all those kind of things. So, my apologies, and thank you for bearing with us. Let me welcome those of you who are joining us. It's always a pleasure to speak with you, and especially on Sundays, because I try very much for us to do a show on Sunday, because we know very well that in South Sudan, the MTN offers bundles, free bundles on Sunday that allow people to engage online and to share knowledge. So every Sunday, we try very much to do a show so that people can tune in without too much cost to them. So thank you so much, those of you who are joining. Please, as we have been doing over the last several weeks and months, I'd like to encourage you, those of you who are joining us, to immediately begin by sharing the video. Share it on your timeline, share it on Messenger, share it on WhatsApp groups, so that other South Sudanese people can come and join this show. You know very well the reason why we have been doing this is to create awareness among South Sudanese people about the situation that is taking place in our country, so that we as people of South Sudan are informed of the issues that we are engaged of, challenges that are affecting our country, and together think about how we can overcome the challenges that South Sudan faces. So please share the video, share it with all your followers, share it in the groups that you are in, so that as many people as possible may be able to join us for this show. Now, before I get into our topic for discussion today, it's always important to repeat things, because we as human beings, you know very well, the only way we learn is through repetition, is when something is repeated over and over again, that such a thing actually gets into our head and our minds. So it's important as we do this, we keep on repeating certain themes that we have mentioned over and over again before. Very much, you know very well, I personally am engaging South Sudanese politicians. I'm engaging South Sudanese politicians because they have failed as custodians of the people of South Sudan. They have failed as custodians of the country called South Sudan. They have failed as custodians of the resources of South Sudan. And because of that, we have to engage them. We have to expose their failure so that South Sudanese people are aware of the extent to which they have been failed by people that they are supposed to trust, people that are supposed to care about their interests. So these political leaders, starting with the president, Salva Kiir, and everybody that works with him, those in the cabinet, those in the parliament, those in the state governments, we have to hold them accountable. And there is a message that keeps on coming, that somehow these are elders. And as elders, we should not call them out in their failures and in their mismanagement and in the stealing of the resources of the people of South Sudan, in the division of the people of South Sudan, in the murder of South Sudan people. That is completely nonsense. These people are not elders. Yes, some of them may be old by age, and that is fine. It's totally understandable. But since they are holding on to political positions in the government, these people are politicians. They are not elders. Wherever they are introduced, they're introduced as politicians of South Sudan. So you cannot tell us that these are elders and therefore we should not call them out. That is completely nonsense. It's ignorant. It's completely being unaware of the realities that people face and how public affairs are handled in civilized societies. These people are politicians. None of them is ever introduced in international conferences as elders of South Sudan. And as a result, we treat them as politicians. If they retire and they go home and they stay in their houses, we will give them the respect that they deserve as elders. An elder is someone that is distinguished in a society, that is no longer engaged in divisions, that is no longer engaged in divisive politics. That is an elder. An elder is someone that is a custodian of the norms and the values of a society, of a culture. So in a place like South Sudan, these people who are completely corrupting our youth, who are doing all kinds of terrible things in the management of daily affairs, you cannot come and tell us that these are elders. They're not elders, they're politicians. In fact, many of them are corrupt politicians. And therefore, we should be able to call them out on how they are managing resources of South Sudan. So this nonsense that there is our elders, I want people completely to forget about it. And we will be repeating it over and over again so that those who are not listening and for whatever reason don't want to hear this message, we will try very much to repeat it so that it can get into their thick heads, so that they actually get to understand what we are saying. So these people, you cannot tell us that these are elders and we have to treat them as elders. Completely no. These are politicians. And as public officials, we should hold them accountable based on how they are dealing. If they want to be elders, let them retire. And I gave an example before of people who are really elders. Those of Uncle Joseph Lago, they have retired, they have done their work, they are there. Only history can judge them. Those of like Uncle Bona Malwal, they have retired, they are at home. They are, public elders. These are people that are distinguished. People like Uncle Abelalier, these are the elders. People like Georgie Kongora Rob, these are elders. But Salva Kiir is not an elder. He's a politician. In fact, he's a very corrupt politician. And as a result, we need to keep on calling him out. So people coming with a nonsense defense that these are elders, let them go to the village. We said that last time. If they are elders, take them to the village. That is the point, and we need to keep on repeating it. Second thing that we need to keep on repeating it, there is this thing that we are touching on personalities of people, personalities of certain individuals. And I wonder, what is meant by that when people say that we are touching on personalities of individuals? What do you mean that we are touching on their personalities? Is it because we are pointing out that physically these people are unfit, especially in the case of President Salva Kiir, that he has age, his body has age, his body is no longer fit for public leadership, and he's holding on to a position of power? Is that the issue we are not supposed to point out? Are you trying to say that physical fitness has no relation whatsoever to the discharge of public affairs? If that is the argument that is being made, well, if that is the argument, then that argument is nonsense. Physical fitness is fundamental to leadership. A leader must be physically fit. Every job that we do in the world, every job, whether you want to be in the army, whether you want to be a teacher, whether you want to be a health worker, whether you want to be a politician, whether you want to be a leader of the country, physical fitness is one of the things that is required. That is why in most jobs in many places in the world require physical examination. You are examined to determine if you are fit, and particularly in leadership. A leader needs to be fit physically because leadership requires physical fitness. Even in our Nilotic customs, when people talk about a leader, even the physical appearance of a person is from there that you judge whether this person is fit to be a leader. It's one of the critical elements that is examined. Even when the chief is appointed, they look, is this person presentable to be a chief? Is one of the things that is required. And in particularly a country like South Sudan that is very young, a country like South Sudan that is very divided, a country like South Sudan that has been affected by violence, it requires a leader that is fit, that is able to visit the people. So if you take, for example, when you hear that there has been a flood in like Upper Nile or in Unity State or in Warab, it required the leader to go and visit the people and sometimes to physically help the people. Like, for example, you find people that are trying to build dikes. A leader needs to go there so that he can also help the people. And if you have a leader that cannot even walk, right? Someone that cannot lift up his foot and is holding on to a position, you want to be a leader. That issue has to be pointed out. You also saw a lot of things. Someone that is sick, that is physically sick, that is unable to discharge the functions of his office and doesn't want to take care of his sickness. Even in a normal job, if you want to be you want to be employed in a particular place, you have to be physically fit. The same thing with leadership. You have to be physically fit. And the question is Salva Kiir physically fit to be a leader? That question is relevant because we have been arguing that physical fitness is a critical element of leadership. Similarly, mental fitness, right? Mental fitness is, in fact, the most important thing because to oversee a government is a very complex issue. It requires knowledge of public administration. It requires being able to make decisions on allocation of resources, on how to deploy personnel, thinking about security, thinking about economy. It requires sharp mind. So if you have someone whose mental capabilities have been degenerated, that have degenerated to the extent that we visibly see in President Kiir, and people are saying that should not be pointed out, especially when that is affecting how he's running the country, then you are not serious about having a public debate about what it means to actually rescue the country. So mental fitness, because everything starts from the mind. Ideas come from the mind. Decisions come from the mind. So if you have somebody that is mentally unfit to be a leader, and people who are supporting him are calling this attack on his personality. No, it's not an attack on his personality. It's an attack on his mind. Is his mind actually prepared to make decisions? And this decision has impact in the lives of the people. It has to be pointed out, right? Character of the person, how the person manage themselves, is important in leadership, because you cannot go and find a thief from the village, someone that has been stealing goods and stealing cows, and you come and make him a leader. And then when people pointed out that you have actually made a thief to be a leader, people say, oh, you are attacking his personality. Does that make sense? Someone who is a murderer has been known in the past to be killing people, and people want to make this person a leader. And you point out, guys, this guy was a murderer, has killed people before. Why do you make this guy to be a leader? That need to be pointed out, because the issue of character matter. Someone who is sleeping with people's wives, right? Adulterer, and you come and make this person a chief of the village. That issue will be pointed out. Go to any village in South Sudan. These are the issues that come out when people are talking about leadership. So you cannot come and tell us that physical fitness of a person is an attack on the person. You cannot come and tell us that mental fitness of a person is an attack on the person. You cannot come and tell us that a character of the person cannot be touched. These are elements of leadership. If you apply for a job, some jobs here in the United States, anywhere in the world, there is a background check that is done to see whether this person is fit, not just only physically, mentally, but also their character. If you find somebody who has debts, right? Someone that have a lot of debts, that have not been able to pay their debt, is financially unsound, and you want to make this person to be a minister of finance, that is an issue. Because this person, those who are, these people that, the people that he owes money to, will come for this person, and is likely to be used as a leverage to make this person corrupt. So therefore, character is important. We cannot just say we cannot be talking about this because these are personal, these are private. No, they are not private. These are critical aspects of leadership. And people don't want to talk about us because they know that the President Kiir is unfit on all those categories. He's physically unfit. You can just see how he walks. You know, you saw what happened many times, many different situations in which he had publicly embarrassed himself and embarrassed the country. That has happened. You saw that mentally, even for him to read, right? Even just the eyesight, very important. If you have a person that cannot see, that cannot read a page in a document, how do you think that this person is going to be reading volume and volume of policies in his office so that they can make a decision and decide which policy is going to benefit the people more than the other? It requires mental sharpness. It requires ability to be able to make decisions. The same thing, a character of a person. Background of this person. Is this person a womanizer? Is this person a thief? Is this person alcoholic? Is this person whatever? These are issues that are critical, and they have to be pointed out, because we need a leader that has a good character, because the leader is the one that upholds the moral values of a society. All the children, young, teenagers, they look up to the leader. So if you bring a leader that has a terrible character, that have a terrible record, then you are degenerating a society. And you cannot be surprised why the moral values of the society are being destroyed when you are bringing leaders into position of power that are physically unfit, that are mentally unfit, and that are unfit in terms of character. This point has to be repeated over and over and over again. So we will be doing this all the time, and we encourage our people to do this all the time. Those who disagree, let them disagree and tell us why they disagree. But those of you who agree, let us join hands and educate them. When they write that ignorant comment, let's try to correct them so that they understand really what is going on. Because our people have been brainwashed. They have been made to tolerate a situation that is intolerable, a situation that should actually make them very, very, very mad. Now, for today, the main issue that I want to talk about is healthcare in South Sudan. I want to talk about health, and I want to talk in particular about the situation of women's health, particularly maternal health, because this is a cross-cutting issue. It affects the entire society. It affects our people. It affects everything that we do as a country. Now, let me start by saying that there is a very close connection between health and economics. Health and economics are very much connected. Societies that are richer, where people are living in wealth, where people have income, people tend to be healthy. Why? Because they can feed themselves better. And feeding, by the way, is the beginning of good health, access to food. Because when you eat, and you eat a balanced meal with a good balance of protein and minerals and vitamins in the body, it prevents a lot of different disease. It keeps the body strong. It keeps the mind strong. It makes it possible for a person to be robust, for the immune system to function, and for the person not necessarily to need a doctor. So economics is critical to any kind of public health. That is the number one. So societies where there are poverty, they're going to have poor health indicators. And this is going to be reality in the case of South Sudan. And we will talk about some of these indicators very soon. So GDP growth and development indicators are critical prediction of whether you will have a society that is healthy or a society that is sick, like we have in the case of South Sudan. And the management of economy is critical, is the beginning of everything. If the economy is not managed well and the people are not having access to income, they cannot feed their families, they cannot afford to live in a good housing, they cannot afford to have clean water, they cannot afford to have heating system and energy system in the country. That from the very beginning is going to point towards terrible health outcome. It's very important we start with that. Second, budget. Budget is the most important tool that the government use in a society to shape the society. It's how you transform society by investing resources in the areas that actually matter, areas that can have impact in the life of the people. So we're going to look at the budget and how the budget is allocated, because budget determines the extent to which the government is going to invest in social services, in which the government is going to create a conducive environment for private sector and private actors to invest in the life of the people. That is another tool that we are going to look at. Now, you know very well, since we got our independence, the economic condition in this country have deteriorated. Poverty rates have increased substantially from 50% at the time of independence to, as we speak, 9 out of 10 South Sudanese live in poverty. That means every year since we got our independence, people are getting poorer. And as people become poorer, they can't afford enough food, they cannot get access to clean water, they cannot afford to take care of themselves. And that is going to affect the ability as people to be healthy. We also know that the budget of South Sudanese government is a budget that is made but is not implemented. Every single year there is a process where there is a budget planning process. When this process is finished, at the end of the day, what is planned is never implemented. And that is a problem. So we have to keep that in mind, that health is a function of economics. Now, in the case of South Sudan, the budget that the Ministry of Health receives on an annual basis is about 2% of the entire budget. 2%. And the international norm or the international expectation is that every single government, especially those governments that are poor, from countries that are least developed, these governments are supposed to allocate at least 10% of their budget to health, right? At least 10% of their budget to the health. In South Sudan, it's only 2%. And these 2% is actually supposed to cover salaries and the operational costs of the Ministry of Health and the transfers by the Ministry of Health to the state's ministries of health. It doesn't really cover much else. It doesn't cover the investment in building the health clinics, primary health care centers, or in hospital. None of it. And you know, in the case of South Sudan, majority of the funding that actually goes into the health, that actually is sustaining the healthcare of our people, come from the international donors. It doesn't come at all whatsoever from the government of South Sudan. And that is beginning where the problem. Now, the 2% that I mentioned, some of the time that budget is not even released on time. So it's on paper. And then when the people actually go to the Ministry of Finance to actually get that money, it's not there. And that is essentially a problem. So when you have a beginning where the economics indicators in the country are very bad, poverty rate is going up, people have no jobs, they cannot make earning to be able to take care of themselves, and then you combine the fact that the government is allocating only 2% to the Ministry of Health, 2% that is not being paid on time, what do you think is going to happen to the overall health outcome in the society? Well, I will tell you what happened to the overall health outcome in the society. Because of the poor allocation of resources in South Sudan, we have only one doctor for every 65,000 people. Let that sink in. For every 65,000 people in South Sudan, there is only one doctor. The same thing, for every single qualified midwife in South Sudan, there are 40,000 people. 40,000 people. That is just the situation. It's just completely horrible because we are not doing enough to fund the healthcare sector. We are not doing enough to invest in the life of the people. And you cannot have a society that grows, that moves forward without health, without them being healthy. Is the foundation of everything. They cannot do anything to improve their lives without them being healthy. They cannot work and make money without them being healthy. They cannot take care of their families without them being healthy. So what does this do? Well, one of the things that I should also probably mention, as I said before, overall economic impact, overall economic situation affect the health outcome in any given society. In a place like South Sudan, other things that are supposed to be taken care of by other ministries, things like water, have huge impact on health. Just the same thing like food have huge impact on health. In South Sudan, only 10% of people in South Sudan have access to clean drinking water. Only 10%. That means 9 out of 10 South Sudanese people do not have access to clean drinking water. What does that mean? That they are drinking water that is not fit for human being to drink, water that is unsafe, water that have like worm and germs in it. And what happened? They get sick. And this is why South Sudan still have some diseases that are being wiped out in every other part of the world because of the poor drinking water condition. You know very well in many parts of the country, women have to walk for hours to go and get water. This is a real situation, and it affects life of the people because there is no clean drinking water. The same thing with food. Just this year alone, 2023, 7.76 million people in South Sudan, according to UNICEF, they face acute food insecurity. That is about 2/3 of the population of South Sudan. They do not have enough food to eat. And without enough food to eat, they will be malnourished. Their body will not have the nourishment that is required for the immune system in their body to work properly. So if they get sick, it's likely that these people may end up dying because their bodies are not prepared to be able to recover quickly. That is a real issue. It has a huge effect on our people because they cannot have food, and particularly on children. In fact, this year, in 2023, 1.4 million children across South Sudan are considered malnourished. This affects the ability to grow physically, to become strong adult when they become a grown-up people. They will be weak, and they will be exposed to chronic diseases because their bodies did not get the nourishment that they require at a critical time in their growth for them to be strong people. This affects them for the rest of their entire life, because as they were growing up as children, they did not get the food and the dietary requirement that their bodies need to grow into a strong, healthy adults. It affects what will be the quality of our workforce in the future. It affects the quality of our teachers, the quality of our army, because the people will not be strong enough. Their body will not be prepared to discharge of their function. And you end up having a population that is completely unhealthy. It affects the mind too, because people that are not fed well, that do not have access to food and dietary requirement their body needs, cannot grow and develop mentally in a way that will make them competent adults when they reach that age. That is an issue. So what does this do overall to our health indicators? First of all, let's look at the life expectancy of South Sudan. From the time you are born, the life expectancy in South Sudan right now is only 57 years. That is, by the time you are born, you are expected only to live for 57 years. It's one of the lowest in the world. And the reason is all these things that I have talked about, including also the fact that our society is so prone to violence and to intercommunal conflicts that are sponsored by politicians who are looking for position, chief among which is President Kiir himself, who has been using division, using tribalism, using regionalism, using clanism to divide people so that he can keep himself in power, so that people of South Sudan are not united and they are unable to think together on how to move this country forward. So that is a key issue that we need to look at. Let's look at what does this the effect of this on our children. Well, infant mortality rate in the world is among the highest. In South Sudan, in fact, in the world, is the third highest in the world, where about 60 kids out of 1,000 are affected to die before they turn 5. This is terrible, my people. This is terrible. This is terrible because it means that we are not doing enough to save lives. And these children are the future of the society, because all of us, we are going to be getting older, and our time will come when we will leave the world. And if we are not investing in these children and making sure that the next generation is healthy, we are already undermining the soundness of our state, the country of the Republic of South Sudan. This also has a huge effect on the maternal health. In South Sudan, maternity mortality rate is among the highest in the world. In fact, 1,223 women out of 100,000 die during childbirth. It is the highest in the world, higher than any other country. And why? It's a combination of things that I mentioned to you before. If a woman is pregnant and is not receiving enough food that her body requires, is not getting nutrients, is not getting clean water, is not having access to the doctors because the Ministry of Health is not funded well, because the money are being diverted and the money is being stolen, then by the time now they reach 9 months, when they're about to give birth, what happens? Their bodies are weak. Sometimes they don't have enough blood in their body. And because South Sudan does not have credible and consistent electricity, we don't have blood banks. And when someone is giving birth in labor and they bleed too much, they could easily die. Sometimes they die together with the children. There are a lot of people in South Sudan that have experienced that. And this is a reality. Everybody that I know, people from every family knows there are stories of women that have died during childbirth or have died during the pregnancy. It's one of the difficult times in a life of a human being, and particularly in a life of a woman when she is pregnant and she's carrying a child. If they are unable to receive the physical support, the health support, and have access to clean drinking water, to be able to see doctors, that can resolve in a complicated pregnancy, and it could become a threat to the life of a woman as well as to the life of the child. This is a reality we face in South Sudan. Right? These are the indicators, guys. These are not things that I'm making up. These are the realities that we are facing in our country. And we know right now in South Sudan, only 19% of births all over the country are attended by trained midwives. Why? Because we don't have enough midwives. Our country does not have enough midwives, and we don't invest in resources. Look at the Ministry of Health. Ministry of Health has been run basically to the ground. It doesn't have access to the resources. It doesn't have access to trained personnel. In fact, all of you know that that government officials in South Sudan have not been receiving their salaries for a very long time. Only last week that the Ministry of Finance released a press statement saying that they're going to pay their salary for August. And we are in December, right? We are in December. And that also means the Ministry of Health. So if you are a doctor and you are working for the Ministry of Health, you're supposed either you are working for the primary healthcare facilities or you are deployed to any kind of hospitals, and you are not receiving salaries every month. What are you going to do? Well, let me tell you what the doctors have been doing. Those good doctors that are well trained, what do? They create their own private practice. Instead of working for the healthcare centers that are funded entirely by the government of South Sudan, they create their own private clinics. And for you to go into that private clinic, you need to pay. And majority of South Sudanese people do not have the resources to afford. Right now in Juba, for you to go to a proper healthcare facility in Juba, private one, you need no less than 200,000 South Sudanese pounds just to cover the basic, to cover the consultation fees, to be able to do basic lab tests. You need that much. And how many South Sudanese people can afford 200,000 every time they're sick? And you know very well there are some chronic diseases to our area. Among them, malaria, because we have a lot of mosquitoes, and our people are exposed to malaria. In fact, it's one of the highest causes of death in South Sudan. We have typhoid, is there. In fact, there are seasons where it get out of control. We have cholera because of poor hygiene, poor drinking water, poor sanitation practices in the country. That has a huge effect. And what happened? You have to go and see a doctor when you get sick. 200,000 just to do basic lab tests. And that does not even include the cost of the drugs. Because after that, when the doctor has seen you and has determined what is the cause of your ailment, you then now have to go and buy the drugs. Obviously, we don't make any drugs in South Sudan. So all the drugs are imported. And you have to go and pay, and they are imported. That means they are paid with hard currency. Hard currency depreciates or appreciates depending on what is going on with the dollar worldwide. So in the end, this ended up having a huge impact on our people, and particularly women in South Sudan. Healthcare problem, sanitation problem, access to drinking water, access to nutrition. These are issues that face our people daily, and the overall outcome in the end is death of our people. Now, you will think this is happening because South Sudan does not have resources, which is not the case. South Sudan has a lot of resources. In fact, from the sale of oil alone, we are making between $300 to $400 million every single month. 300 million to 400 million every single month. Where does that money go? Well, you all know where the money goes. The money is pocketed. The money is given on fake contracts, like ARC, the company of Bull Mill, which is building fake roads, exaggerating the cost of the roads, and the money is being pocketed. Only 10% of it is being actually spent on the road, while the 90%, a lot of it is being taken back and being given as kickbacks to the president, to Salva Kiir himself, and to people in his government, especially those in his cabinet. This is what is being done all the time. And all of you know this. This is the reality of what we face in the country, right? Fake projects like the Akun International Airport that is being built in the middle of nowhere, in a place that has no drinking water, a place that has no sanitation of any kind. Those are the fake projects that are taking the money. And what is the outcome? Death of our people. Well, people are dying in large numbers. Women are dying in large numbers in the country. So this has to change. And the only way it changes is for us to begin managing the government better, being able to manage our resources better, being able to prioritize our resources better. Obviously, in a country like South Sudan, there are so many competing priorities because many things need to be done simultaneously. But we have to be able to prioritize to see what can we do now, what can we do tomorrow, what can we do the day after tomorrow. And that requires, as I said many times before, leadership. It requires leadership that is fit physically, leadership that is fit mentally, leadership that is fit in terms of character, which we do not have in the person of Salva Kiir. Salva Kiir is unfit physically, is unfit mentally, his character is completely deficient. And we cannot change this situation in the country without removing him. And that is where everything starts. Everything starts with us fixing how we manage our government. Because in a country like South Sudan, the private sector is not strong enough. We have a very low base private sector, and this is because of many reasons, including our long history of marginalization by the North, and the fact that our people were treated as second-class citizens. Our country, our area was deprived of investment that are critical to us to improving our overall condition. We know that. That is the history from which we come. But since 2005, we had a chance to change this. But we cannot change it because we have a leader that does not prioritize investing in his own people. He would rather steal the money with a few crooked individuals that are with him in his government. That is the reality of the situation that our people face. And the only way we can change this is to start by removing him, so that we have the ability to fix the government, so that we have the ability to prioritize how we allocate resources, so that institutions like the Ministry of Health get the resources that they deserve, so that they can invest in a healthy society. Healthy society is a happy society. You cannot have a society that is completely run to the ground like South Sudan and expect that society to function and to perform very well. So this is a situation that faces us. We have to start, number one, by removing Salva Kiir. And when we remove Salva Kiir, we will be able now to allocate our resources to the key issues that matter to the long-term viability of our country, South Sudan. I want to talk to the women of South Sudan directly. You know very well the situation that you face. In fact, we are a country right now that does not really invest in our women. I just mentioned all the health indicators. And this is a situation that faces many of you, whether you are a mother, whether you are a grandmother, whether you are still a young lady. This is the reality we face. We have a society that does not invest in the healthcare. Even basic sanitation for girls is a problem. It's not a priority in our country. So you, as women of South Sudan, I want you to think very critically about this situation, how we can work together to make sure that this situation is addressed. And as I said, the beginning is to make sure that we remove this guy called Salva Kiir. And the time is coming for us to be able to do that. Now, you know that everybody in the country now, because of the poor health indicators in the country, people are running outside South Sudan to go and look for better health. Starting with our president. Every time he jets to Dubai, he goes to South Africa, that is where his doctor is. What about the rest of the country? We are just going to be left there to die without any proper healthcare attention. People are running to India. Every time people are waiting at the Juba International Airport for a dead body to arrive from Egypt, from Jordan, from India, from wherever. This is the situation that we all face. And you, my people, we have to wake up. And we are the only one that can address this, because no one else is going to come from anywhere in the world to come and address this situation for us. We have to be the one that do that. There is no way you can have an entire country without proper medical facilities, where all our leaders have to be the one that run away and go to Nairobi, to Aga Khan Hospital, to Nairobi Hospital. What about the widows, the orphans, the veterans that cannot afford that? They will be left to die, and they will die of simple, treatable diseases because you have a government that has decided to be a government of thieves, government of stealing resources, and you, citizens of South Sudan, you want to continue to tolerate this? My people, we cannot tolerate this. We have now a government that is run by immoral people. Right now, you know the situation. If you're a young woman in South Sudan, you cannot get a job. Somebody will only offer you a job with the expectation that they have to bed you. They have to sleep with you. This is the situation in South Sudan. No, right now, young women even to get a contract, whether it's in the Ministry of Defense or wherever, office of the president, someone expects to sleep with you first before they give you any contract. The same thing, if you want to be paid, even if you get the contract, after you have discharged the functions of that contract, for you now to be paid, someone expects to sleep with you. And many of you, all these young entrepreneur women that are trying to compete in the market, you know this situation. This is the expectation of these men that are running the government in South Sudan. And people say we cannot talk about character. Even from the top, from the office of the president down, this is the situation that our women are being subjected to. Is this okay? Is it okay for your daughter? The only way that she will be paid is for her to sleep with someone in her own country, regardless of her qualification. People will expect to sleep with her so that they can give her a job. You have now a government, especially if you go to a ministry like National Security, where every single office has a bed in it. And in fact, the closer you are to the president, the more this thing is actually prevalent across the country. Is this acceptable? And you don't want to talk about this? You don't want to talk about this situation? Well, then what is it that you want to talk about? You want to sing song and praise the leader so that you are given a hand out. Why do you beg in your own societies? Women of South Sudan, is this okay? Your husbands are the one that fought, liberated this country. Your brothers are the one that fought to liberate this country. Your fathers are the one that fought to liberate this country. And you, the women of South Sudan, I remember during the liberation struggle. In fact, this liberation that people are talking about would not have been possible without you. Without you, there would be no liberation whatsoever. I remember the work that you do. You provided food, you carried it to the front lines, you nurtured the soldiers that were wounded, you treated their wounds, you cared for them, you provided them moral support, you allow your husbands and your sons to go and fight, and you take care of the children on your own without support of anyone, believing that once this country is liberated, it will be able to reward you. And right now, people expect you to open up your legs for them to allow you to have your right as a citizen. Is this the country that we all fought for? And my brothers, those of you, and you know this, in the government, in the ministries, in the office of the president, somebody expect to misbehave around your wife because they have more money than you. Right now we have cases, even officers, where their fellow officers are misbehaving with their wives or their sisters because they have been looting money, they have been closer to the looting circles of Salva Kiir, and therefore they feel they have a right to destroy your families, to come and expect to sleep with your woman, and then you are not supposed to do anything because obviously you are poor and you cannot do anything. Economics have forced you into that kind of life. Is this acceptable? Is this what we expect to accept, my people? Is this the kind of country that we fought so hard to liberate? And you don't want to talk about a character of leaders. Oh, that is attacking their personalities. Is it attacking their personalities? Does character not matter to leadership? You want to say that in a leadership like a country like South Sudan, the character of a person is irrelevant? My people, let us be practical. Character matter. We have a country that has become degenerated morally, physically, spiritually. A country that has essentially become Sodom and Gomorrah. Yet it used to be the most beautiful country in the world. And it can still become the most beautiful country in the world. We just have to get rid of the source of corruption, moral corruption that is affecting South Sudan, which come from the top. And just like a fish, South Sudan has rot in the head because of the leadership of Salva Kiir. We have to be able to remove this person. And he is the cancer that is ailing the entire body that is South Sudan. Look at what he has done in the East Africa community. He went literally and have a map. He approved the map. Oh, he's the chairman. Approved the map, a map in which large territories of South Sudan have been taken by Uganda and by Kenya. Territories of South Sudan. And our military is there only thinking about killing the people and is not thinking about how they can defend the borders. This is unacceptable, my people. We have to change this. And you women of South Sudan, ask your husband, What is it that they are doing? What is it that what kind of men have they become? Men that accept for their wives and their sisters, their women to be degenerated to the level that they have been degenerated. Yet they continue. You saw them the other day, yesterday, when they lined up at the airport, waiting for Salva Kiir, Babaja, Ding Ding Ja, waiting in a circle. And these are people that call themselves liberators. These are grown-up men. But they have been turned to psychopaths simply because of money. Morally corrupted to the core. You have to begin speaking some sense into them. And you cannot have them to have this weird expectation on you. I remember reading a story not long ago of a certain husband that came home after playing cards and dominoes all day. And then the wife did not come to the house and there was no food. And he was making a lot of noise in the house. Why did the woman not prepare food? Yet there was nothing that he has left for these women to eat. He has not left any food. He has not left any money. And then he had he speared the woman. He speared the woman. You know the story the other day of the father in Toin that blinded his daughter. Blinded his daughter. In our country, life of a woman has become worthless. And you women of South Sudan, I know the situation is stacked up against you, but you have the ability to change this situation. And I appeal to you, my people, let us change this for the better. I want to summarize, because I'm not going to go through everything that I've said, but I want to summarize everything that I've said in Tong Monjang. Wake we Monjang. Ayak luel kanang ke chorandit. Randit yung randit lo akin ke chorandit in siasa. Kir mayadi da kir her ke randit. Akan ke konping a kultok to choli yen UN kule randit de South Sudan a ben a chelwela ya. Ayelwel benye Junuba Sudan a ben. Rais Junuba Sudan, a politician. Now a politician ranchit and a rival along Salva Kiir. Kunaya rival kache dide yen mohem e tunto yenten yen adile le yit chikur beke pinge adianga kalwel beke ping na e chikil yedut beke lo nongin beke la ping tutui kalwel bi ko ye ping psychopaths ke matokrap ke beke la legen wel ke yelwel ki elwel yin inchu lui fail in chu baya cha gur yetin on bi by 2011 good che cool koi ke to koi ke ngong ai kam sin filmia e cool koi re ke ngong ke chin ke cham ke e tisain filmia koi ke dong wan tiare are ke ange Junuba Sudan ai cool yeri re banye ngong e lo ke jwa rot po wa ro jwa be je ro jwa fi Junuba Sudan because yena chi lui fail kor ba ke de ra chinge cho randit CSI na ye randit cha lo bible nyuch chi man to yi kongura rob rare bai chi ran cha kon ping nong lwe le gop tariek ke den chi loy bana beto tariek ke a koy be a kwen mi sukul ga be jo alwe yengo chi ro loy nongen uncle bona malwal to pande uncle belalier to pande uncle Joseph Lago to pande uncle Angelo Beda to pande a koy dir kir ma yarit che randit CSC chi bai god no pin CSC chi bai right ku ka diang legi yin chi bai right kwa le ko ken ma tokrap ken ya kwanchuk that wake we chi bai cha right ek muhem chan be dil det anan ko jam ku le check si banya che ata yung ene check si ban lwel e jienge ben ay kon lwel ran kene gob de je ko de ja ba ran ye ben so na ran to ko chi twine aka yan ake yela bai be ben banye di maki be ko lo be ko la pana kim ro lwe ala chu ran chine chuk tire chat che chu ka jot pin lwe ka chi lwel ma banye ko na riele gop e one of the things e ko etunga ka yega ting to kwenya ban bona mon jang kwanyen riele gop ay ting ran kene riel gop or not e ke ye lwel kanan ko ye kaye ban ga loy lwel kaye ran ga loy ay ga lwel banye na ye ran ye chwe ku to kwenya ban ku ke chwe ran ga ngi ke chwe wana chi tu ko nge a chi ka kwal a chi we nge chi kwal chi man ko wona tu la kwal ku ne ke ko bore ku chwe de ke ku le ran chi ke na kwan ke ban ye lwel ke den on yen chwer a chi lwel le be chwer be kwan ke ban ku le chwer yen chwer a chi lwel ye ran woni diare koy kor e helay le be kwan ke sultan be ye be yen chi riel a chi le be kwan so kay ran ko loy gob de je ay muhim adeg miaw lwel ka chi lwel be chi lwel adi ku ka lu ko be ya ban be ya muksulo ko ma ke de na yen adeg miaw a lwel because wo ben enge ka ye mit kor to dir ke ay ngel wel an ko ba cher nge quran e ting ran ben e yen ben kana ye ben la wil lui kala wil ke e ba ye rio noms ay ga rai we chi le bagara la kwan ran wona chwe ran wona lui karai ana ko ku lwel ke ben ku ka ken ga chi ka lwel ke be ke che lwel ke chol ngu em lwel ke jem wo tine kule e ke chol pial de gop au twang ku pial de gop de junuba Sudan health nge ke jem wo tin sa junuba Sudan ku sa atia kene pire ko wona rere ke healthy au rele ke rel a ko non ke chamke because gop e ko na chem ke chem ran gop e jenge ko na kriye ban na chin cham queen chem ran kara na chi librial kuna ran chirel le big le dom kalibeto e ko go ting man ko tiene ko to re tin man sejen e because a chin queen pia de cham kana lo ko dom be chin mia ko go du to kan yop ke benya ali bi airway chala I che benya bi nok because in go du a chin miet chem ku pa ne cho University Sudan ma on chane wel ko ke to ngwan ko ke tiere a re ke ngong ke chin ke cham ke men ne ko chin queen abaj a chi UNICEF a chi wel 7 million ke chir biag de diak chin de 2/3 yeah ko ke 7 million taban University Sudan ngi 11 to 12 million people so almost 8 million ko a chin ke cham ke kumit ko ke ngwan mit ke ne die chinwe 4 million mit a chinwe 7 million ko to University Sudan a ko re ke chinwe chin ke cham ke because by a chi kono ko a chen ko mai chok bu ko re ke chok chin ke cham ke Quran chin ke chiam ran chin we kule bi le dom ka che e bi che edway akuma University Sudan e only 2% yan 2% budget nga ye ler nang Ministry of Health wazara sa yung ye kene ye loy pire ko University Sudan mana pire ko ya lai to ke ta to ne ran ken ben because go beto ke chin you diar especially diar dior ga to University Sudan ke pan to twing e to ne diar e ta dit ke diar junub mana ai to ta ga dit because tik mine you and met abre ke chin ke chiam ab chin piu ne dif de ke a chin pana kim le entin ab jori ke go to bi do ba dom ale ben mi ta ga dit ku dit ku je be queer ko go ba to ke riam kwen ki a chin tutorium tin bi rem ba dai la be chan bran der krana to edway to ku ke likely man a windi dit to yan piu abaj e University Sudan piu ne di be ke yo a ko le dia ka ke yo a ngeke dictor ali ku dictor li ke a chin wu ye ke yen ke me ha ma ngek we ka che ben so most of these dictor ke e ranam jota be mit ke be ga mudi ke be jal bro la we clinic tin den ben ane ko diang na wu ke be ya ben ko be ke ting ko ngeki juba bala pana ki ma baj chan be dictor bi ting ku be ke she beloy e ko kor wo wen le kane rana wen chin ke to kane yen ge pir to University Sudan ten ku diare University Sudan ke ka je jomam jaga ting man ba e chol University Sudan tik awum nyandu ke ine ran je tor ba bai bebe a chi le bulwo yo ai ran wo e pyo ke be kontai chan be jo ye loy be kontai ting du chin rieu ku ke gol twing min nyal ben be be gutirana ben engati in chenga bai ten ko elwe ka chi lwe ka lwe yung yene check si nge la ben wow elwe chi lwe ta chi lwe la di kana adile lwe bai adile ger be bai be lo twing bia pa na wen nong rieu pa na wen en yene diar te gu ten ku pa na won lwe le yen diar a chi lui a je to tong nge ke katifa banat ka chi ta katifa banat ka loy a tung ka chi rul ka loy Inga tande wan ke moy ge wan la tong kene ra moy kena je dong chuk ye nga wan ke wan ke tuk a we diar inga tande ke rur wan ke la twen we ambre ya ga loy e yot queen ya ga la kuru wechen rur kun acha ka pol bila tong bila thor wera met kun acha ka pol bila tong bila thor mit kun acha ka pol bila tong bila thor na je bai jo ben be chan ba luoi yo be nyan du ba luoi yo ke ki eran wo e pio e bi kon ja tai chan ba luoi yo bala ko contract chan ba contract ba yo ki eran wo e pio bi kon tai bi jo yen contract bi bu ku bi ke ben be e wo e pio e bi kon tai ye we di har ga ju nu be ken le ba ka gam rur kun especially him on je kin ga to gana yin chwer ge to makta me benye je ti ha go gana ben gana e jo chen sut ku jo ben jo romu ri ko nim ke ko e pio e be ting du be loy ke lu yen ku chana chok ko ya nim jo mum kra na lo ko je ke dang loy ke wen che yi ko ko pa na che bai ku ke lazim ka chira ke be ke lwel ku be kriye je ben be war chi bu war kra na cho kir ma ya dit to ko nim e be kir nyai kurun bo 2024 engaruna nyai kir lazim be kir be dil nyai so wake my people. Just to conclude, I want to say the only way we can rescue this country, the only way we can move this country forward is by changing this leader. This physically unfit leader, this mentally unfit leader, this leader with a terrible character and terrible moral values, he has to be removed. And from there, we will have a chance to put our country back together. And the year to do it is 2024. You and I, we have to do it. You have to think, what do you have to make this possible? If you have money, that money, we will need it. If you are a soldier, we will need that. If you are whatever, we will need that. 2024 is the year we are getting rid of this guy. And we will start immediately doing it as early as the new year. And we hope each one of you will join us in this struggle. Please share the video. Whether you are a Matograp, a bootlicker, or someone that actually agree with us, that someone that is a revolutionary, a patriot of South Sudan, share the video and let us begin working to bring about a better country that work for our people, that work for our women, a country in which we will be proud, will be treated with dignity, where our people will love each other with one heart. This is possible, and we are going to do it in 2024. Our land is a land that is blessed. It wasn't wrong to put in the national anthem that is a land of great abundance. But this abundance has been exploited only by a few individuals. It's not benefiting the entirety of our society. And 2024 is the year we are going to begin by taking our country back so that that abundance may benefit every child, every woman, every man of South Sudan. May God Almighty bless you. Share the video, and I look forward to seeing you the next time. Happy Sunday.